am Muriel Bowser. I'm the mayor of Washington, D.C. I'm joined today by members of my administration, including Dr. Shaw as the district's COVID vaccine program lead. Dr. Shaw works side by side with Dr. Nesbitt on the district's vaccination plan. I'm also joined by the Deputy Mayor John Falchicchio of DMPED and Chris Rodriguez, the Director of DCH-SEMA. Today, we will go over the adjustments we made last week to phase 2 of the mayor's order, including the holiday pause that goes into effect this Wednesday evening. We will also update you on the vaccine distribution and a note about DC recovery. First, let me start with our testing schedule for this week. So please notice the various locations around the district where one might get tested, including our 4 firehouse testing sites that we will open on Sunday. And last week, we tested 20,700 people at our public testing sites. That's 2,000 more than the previous week. So please go to coronavirus.dc.gov/register to register beforehand, to input your insurance information, which will save you time, and it's more convenient than doing it at the testing site. Please remember that getting tested is not a replacement for exercising good judgment, wearing your mask, washing your hands, staying 6 feet socially distanced, and limiting your activities. We also want to share the dashboard of where we are with COVID in the city. Every day we report out in 4 basic categories. How much virus are we seeing? How is our health system performing? How is our DC public health system helping to monitor and contain the virus? And the level of community engagement with all of these interventions. So as you can see, we have been very closely monitoring how our hospitals are doing. And for several days, we have seen increasing numbers of the hospital capacity dedicated by serving people with COVID, including all the very intensive care that they need. So as we think about all of our activities, we're really aiming to make sure that our hospitals can handle people who are need COVID care, but also all of the other care that people need in general. So again, we see hospitalizations and unfortunately deaths on the rise. Today we reported, for example, that 5 people succumb to the virus. We recognize that what we've asked around the holidays is a difficult sacrifice, and we're asking everybody that even while we see that we're on the verge of really getting this virus under control with a vaccine and vaccinating Washingtonians, this is the time where we have to continue to be extremely vigilant. We're asking everybody to protect themselves and their families by staying home, not traveling, limiting your activities with other households for the Christmas holiday and New Year's Eve and everything in between. Here are some do's and don'ts. Keep in mind the most vulnerable members of your family while planning. As I mentioned already, testing, it has its limitations. And so while testing is important to stop the spread of the virus, we also don't want you to get the virus. So, and you don't want to get the virus. Wear masks, socially distance, practice good hand hygiene, and limit your activities. We're asking people not to travel and gather in groups and have different members of households sitting close together. And please pay close attention to not letting your guard down in familiar places around familiar people. That is your own home or friend's home or relative's home. Still wear a mask. So now let's turn to some additional phase 2 adjustments that we announced last week that would go into effect this Wednesday. First, I extended the public health emergency through March 31st. You will recall that the council voted to extend this authority, and I'm exercising it by mayor's order. We're also pausing a number of activities from 10 p.m. this Wednesday to 5 a.m. on Friday, January the 15th. There's been a lot of reporting already about that we are pausing in-person dining in the district, but we are strongly encouraging our residents and visitors to take advantage of delivery and grab-and-go options that our restaurants will continue to provide. Restaurants will continue also to provide outdoor dining. A note about outdoor night dining, because we know there have been a lot of questions, so our Office of Nightlife and Culture is working with restaurant owners to answer their questions. So it's kind of specific, but Nightlife and Culture will be able to answer your questions related to dining structures and tents and canopies. They are permitted to have up to 2 side flaps or walls, as an example. And this is updated from 1 side flap. Don't say that too fast. Okay, streeteries and parklets, this is an update, cannot be used during a snow emergency. So previously we'd said that 32 degrees was the marker. The marker is if a snow emergency has been declared. Additionally, all previously permitted outdoor structures with more than 2 sides and approved by DCRA may continue to operate. DCRA and our DC Health will work with businesses to ensure their compliance. There will also be updated information here for restaurants regarding the use of electric heaters and how to obtain a permit from DC Fire. So if there are questions after that, we'll answer. Further, let me be clear about what we mean by maximum telework, and that is associated with mostly office type work, and all of the orders related to non-essential businesses relate. I'm sorry, I said that wrong. What we're saying is that non-essential, non-retail businesses are subject to the maximum telework requirement. Retailers are subject to the maximum space and occupancy requirements that we have issued in previous mayor's orders. For example, bookstores and salons refer to the previous orders as it relates to maximum spaces that can be used. So now let me quickly go through a few others. Museums can no longer open during the pause, and indoor services and libraries are also paused. Our Department of Parks and Recreation pauses all activities inside except where they have individual scheduled sessions at pools and the fitness rooms. Let me also be clear about grocery stores. Grocery stores are not subject to the specific occupancy number, but as previously, they are subject to social distancing plans that they put into effect. Finally, for houses of worship, obviously going to religious services is a wonderful tradition for this time of year. Certainly it has been for my family, but we will be choosing to go next year and not this year. We're recommending that DC residents attend virtually as well. And we want to thank our faith-based partners who are going above and beyond to make those virtual services, interacting online giving easier for their congregants. And now let's turn to a few vaccine updates. I want to thank all of our healthcare providers who helped start up an efficient rollout. I also want to acknowledge and thank our first responders who I joined with Dr. Nesbitt last week at Kaiser Permanente. Kaiser Permanente is one of the district's first vaccinator partners, and we are grateful for their partnership. So I am now going to turn just to a few updates about that and ask Dr. Shaw to assist me with some of this information. So over the weekend, both the FDA and CDC officially concluded that the Moderna vaccine is safe and effective for use in people 18 years and older. And just like the PFIZER vaccine, years of research have gone in to the development of all of to what has brought us to this day with this vaccine. So this has been years in the making, in other words. This year, more than 30,000 people participated in the Moderna trial. You all may have been following Deputy Mayor Turnage, who was one of the people who participated in the trial. And so with 2 doses of this vaccine, it has proven to be 95% effective. It is reported that there have been common immune responses to the Moderna vaccine: pain at the injection site, fatigue, headache, and muscle pain, and or joint pain are common from getting these doses. So last week, let me say a little bit about the number of doses that have been delivered and that we expect. And actually, let me turn to Dr. Shaw to talk about the distribution.
Thank you, Madam Mayor. So last week, the district received 686,825 doses of the PFIZER vaccine, shipped from Monday, Tuesday, and Wednesday. So within a week, our hospital partners and Kaiser Permanente have already administered over 4,500 vaccines in incredible time. This week, we are set to receive additional Pfizer and Moderna vaccine from different sources. The federal government Operation Warp Speed will be giving 4,875 doses of the Pfizer vaccine and 12,600 doses of the Moderna vaccine. However, as was mentioned before by the mayor and Dr. Nesbitt, the federal government has allocated our vaccine based on our population, not our healthcare workforce, and our healthcare workforce mainly resides in Maryland and Virginia. So through the advocacy of Dr. Nesbitt and Mayor Bowser, we were able to get additional vaccine from Virginia and Maryland, about 8,775 doses from Virginia and 8,000 doses of Moderna from Maryland, which are already being shipped from Virginia to DC as we speak. So with these doses, with the PFIZER vaccine, which I would like to remind you all requires ultra cold storage and these ultra cold freezers that are mainly in our acute care hospitals, these vaccines will be distributed to Children's National Hospital, George Washington University Hospital, Howard University Hospital, MedStar Georgetown University Hospital, MedStar Washington Hospital Center and National Rehab Hospital, as well as Sibley Memorial Hospital, to help vaccinate their healthcare workforce. In addition, George Washington University Hospital is partnering with the Psychiatric Institute of Washington to help vaccinate their staff as well. With the Moderna vaccine, which is similarly as effective as the PFIZER vaccine and has a similar immune response profile as the PFIZER vaccine, it does require easier storage and handling. It could be stored in a refrigerator, for example, and stable for 30 days. So we're disseminating this vaccine across a few of our federally qualified health centers, including 2 Community of Hope sites, Mary Read and Conway Center, the Mary Center at Georgia Avenue, Unity Healthcare, Brentwood, as well as Upper Cardozo, and Bread for the City. Additionally, we're partnering with Safeway pharmacies and Giant pharmacies across the district to provide access points. The Moderna vaccine will also go to Bridgepoint Hospital, both Capitol Hill and National Harbor, to vaccinate their staff as well as the patients and residents there. Kaiser Permanente, which is our partner for our frontline public health and EMS, St. Elizabeth's Hospital, and United Medical Center as well. Additionally, 4,500 doses will be transferred to support our skilled nursing facility and assisted living facility residents and staff through the pharmacy partnership, which is mainly vaccinated through Walgreens and CVS pharmacies. So with this, I think it's, we are able to vaccinate more and more of our healthcare workers. So last week, as you know, we focused on our first responders and those in the acute care hospitals, the ones in the ERs and the ones in ICUs. Now we're really able to spread that to vaccinate other high-risk healthcare workers. So with this includes those in frontline public health, but also EMS workers, so not only fire and EMS, but other EMS workers, our skilled nursing facilities, as I mentioned before, but also inpatient psychiatric patients that are there for a long time, considering them as long-term care residents. And through the pharmacies and the federally qualified health center partnerships, we're able to vaccinate intermediate care facility staff, home health aides, urgent care workers, and start the vaccinations for those pharmacists and federally qualified health center staff. And the way we're partnering to do this is later this week, there will be an online registration tool that will aim to connect those individual healthcare workers to these access points to help schedule and connect to vaccination in this week, at the end of this week and coming next week.
Thank you, Dr. Shaw. And now let's turn to a update from DMPED on the Bridge Fund. John?
Yes, thank you, Mayor. Today we're announcing and launching the application for the first, or excuse me, I should say the last batch of the Entertainment Bridge Fund. So the Entertainment Bridge Fund application will launch today. There are $29.5 million available, and this is primarily focused on the entertainment industry. There are sort of 2 pools of those who are available, the venues and then the supporting businesses. So the way that we got to the $29.5 million in relief is the $100 million bridge fund had originally proposed that we put forth $20 million for the entertainment initiative. However, when we executed the hotel industry fund, we got about $20 million in applications, and we worked with our partners at Events DC in order to award and disperse those dollars. So that allowed the balance of that $30 million to fall to the Entertainment Bridge Fund, and so we're able to invest more into this industry, which has been particularly hard hit because the public health protocols have caused most of this industry to close during the public health emergency. So we'll accept applications beginning today, and the pools of venues will have until January 11th to respond, and the pool of supporting businesses will have until January 19th. Tomorrow we'll actually have a town hall. DMPED has a recovery weekly check-in every Tuesday at 4 p.m. And we'll have a town hall where we'll talk through the elements of the Entertainment Bridge Fund in order to walk through the application, answer questions, and then hear from operators within the industry in order to hear their feedback and hear how they've made their pivots throughout the pandemic. So with that, Mayor Bowser, folks can go to coronavirus.dc.gov/bridge fund for all the latest information about this application.
Thank you. Thank you. And finally, again, just a fun graphic to remind everybody to stay home for the holidays. Let's continue to be vigilant And let's also watch out for when it's our turn to have the vaccine and make a plan to get vaccinated. Okay, any questions? Yes.
What went into the change to reclassify what is considered indoor dining with those outdoor sides? And also the change to going from freezing and below to now no snow emergency, no outdoor dining during snow emergencies?
Want to
Sure.
talk about that?
So over the course of the pandemic, the Mayor's Office of Nightlife and Culture, along with DMPED, as well as our sister agencies such as DC Health, DCRA, FEMS, have all worked together in order to put protocols in place that would actually keep residents and operators and employees safe. And in the determining kind of the pause and the guidelines for the pause, what we came to realize is that some of the protocols that we put in place were a little bit more stringent than they needed to be in order to keep folks safe. And so what we did was make it a little bit more clear that the temperature could drop while somebody's in the middle of a meal. So we don't want that to happen. We don't want folks also to be outside, though, if there's a snow emergency, because that means that plows and other apparatus are moving around. So we wanted to provide clarity for exactly when folks should close because of cold. And then also we've worked, like I said, to make sure that folks are clear about how many flaps or walls. There was still some concern from operators about the clarity on how many flaps and walls. So we're trying to get that information out. We'll obviously take this that you see on the presentation today and put out more guidance. And then also we'll have our Mayor's Office of Nightlife and Culture with us for tomorrow's Recovery Weekly check-in in order to answer questions from restaurant operators as well.
To that, Mayor, the order that was released last week, it also announced the lifting cap for the big box stores. How do you want or expect business owners, restaurant owners who will have to close on Monday, how do you expect them to react to this, seeing that those limits for those stores were lifted?
I don't know that I connect the two.
Message you would say to those restaurant owners that have to close on Wednesday that are also seeing the news that big box store capacity limits have been lifted?
Well, I think you know that the change to how big grocers, food sellers, including big box stores operate was changed on Thursday and changed on Friday. So I don't know that there was a material change to how they operated or have been operating during this pandemic.
I get the question is along the lines of, and we're reporting on these different box stores. Walmart fits the example where you're seeing a lot of people in these stores. Social distancing is not always easy to operate, but these stores are allowed to operate, and now you're asking restaurant owners to shut down for a few weeks and during the heaviest time for these restaurant owners.
Well, I don't know that it is the heaviest time for restaurant owners, but I am asking them to do it. And I am, like I said, the change didn't really go into effect, I don't believe, for our food sellers, including the big box stores. Yes.
Mayor Bowser, as you know, and you probably heard that the Congress has come through with a relief package. Have you looked at it in terms of how it affects the district? And just to clarify for some people, you have a program that pays district residents $1,200 if they're unemployed through the Pandemic Relief Program. Does Congress's new program affect that in terms of the $600 people are supposed to get?
It will not. So what you're referring to is we announced maybe 2 weeks ago that we would, for some DC residents who are 1099 workers, or people refer to them as gig workers, if they had applied for unemployment, then we would extend, by November 30th, then they would be extended a $1,200 payment sometime this month, and that is unchanged by the congressional action.
Any sense about what this COVID relief package?
Well, we're digging into it. And did they vote yet? So color me skeptical, so I'm gonna wait to comment on it until it's done. But both sides of the House, if you will, and the Senate, I think have talked about and has said that it's gonna be voted on in place. And I think that there's going to be a lot of editorializing about what's in it and what's not in it. But I am kind of thinking about those Washingtonians and frankly our fellow Americans who at the end of this month are going to have absolutely nothing. So it's something. And we are looking at the various tranches of money or buckets of money to see how they impact our agencies. There's no state or city funding, I'm told, per se, like the CARES funding that we've been talking about for the last year. But there are buckets of money that will impact our budget, we think, in a positive way, related to schools, transit, rental assistance, child care. What am I missing? I think those are the big buckets that are included. And the unemployment and direct payments, we think, are also very good for DC residents in our region. I think there is, you remember when there was the $600 plus up for unemployment. I think that is now $300. And we also understand that there are to be direct payments to people, to single individuals, $75,000 and below, and couples incomes of $150,000 and below. That would include dependents up to 4. So that is, that's also good for DC residents. Yes, Lou.
In terms of the pause on the indoor dining that you put into effect last week, many, as you may know, of the restaurant and bar owners and employees have been saying or claiming that the DOH or you have not put forth any kind of scientific evidence showing that indoor dining would result in a greater number of COVID cases or infections. Has DOH or you cited any data that these people claim have not been coming forward?
Well, Lou, I'm not sure what you're referring to, but pretty consistently, dining has been cited as one of the sources of with people who have COVID infection as one of the sources of activity, along with other things, but dining is pretty consistently in the top 4.
Words, is this from the CDC or from DC's own cases that you're citing?
Yes, coronavirus.dc.gov, we have a plethora of information about sources of activity. Now, having said that, there are other sources of activity that are essential activities, including people going to their essential work, including people going to school. So there are a lot of sources of activity, and this in no way, unless we stop everything that we're doing, that's how we know that people won't be circulating and exposed to the virus. So we have been dialing back for several weeks, many weeks, the types of all kinds of activity, including in restaurants where we stopped alcohol sales after a certain time, and we dialed back for a time the amount of people allowed in the buildings. So what we are very focused on now, like jurisdictions all around us and all around the country, on how to dial back even more activity. And we know that this is a limited time, and we're asking everybody to make this sacrifice so that our hospital workers won't be overwhelmed following these holidays.
One separate issue related to the impact of COVID on the city's budget. A number of organizations that I follow with the Washington Blade, over a dozen LGBT groups, said they sent you a letter last week urging not to have any budget cuts for social services related programs, many of which deal with the homeless. And what they said was they have been contacted by representatives of the Department of Human Services, informing them that they should try to look into cutting at least 10% of the funds they've been getting from DHS to deal with programs, social service-related programs. I don't know whether you've seen the letter yet. They said they sent it to you, but they said they want to urge you not to do that. Do you have any response to them?
Well, my response is I certainly understand how nobody wants to live with less money. Believe me, I understand that. But as a government, I'm sure you can understand that is an unsustainable point of view. And so what we are doing is we are in our budget process, kind of online with every year around this time, except maybe a little bit more advanced. My agency directors are working with my budget team on how they can do everything that we're all accustomed to doing, given the amount of revenues we expect for the upcoming year. And we don't know what that number is yet, but it's much less than it was last year this time. A lot less. And so in order for us to have a balanced budget, we're not the Congress. We can't spend and grow big deficits. We have to balance our budgets each year. I will have to advance a balanced budget to the council that allows us to do everything that's important, mission critical, and all of those things that help us be the great city are going to help us bring ourselves back after COVID. I'll have to do all of those things and likely do it with substantially less money. So yes, I'm asking every agency, I'm even asking our nonprofit partners to look at your mission critical activities and tell us how you're going to get those accomplished, likely with less money. Yes.
Good morning. So as we know, this virus has been very unpredictable. So I'm curious about how you landed on the January 15th end date and how you'll decide whether or not to extend that date further.
I don't expect to extend the date, so I don't go into it with that expectation. And we know, and the health department tells us that 3 weeks is a good intervention interval. And it will put us we'll start to see the impacts 3 weeks after the intervention begins.
Tied to the Christmas, the holiday period, that's what you're waiting to see?
As I said, yes.
Okay, got it. Okay.
That's why it's called the holiday pause.
Got it. And then one more question from my colleague, Amanda. She wants to know, in Wednesday's order, you level the playing field and reduce capacity to 25% at various locations. And then Friday's order, there's things that residents can enjoy for free, the museums and libraries that are closed altogether or can only do curbside. Why were museums and libraries singled out compared to, say, Walmart and places like that?
Walmart is a food seller. And so I'm not going to be closing down grocery stores. You can't see why we can't do that. It seems pretty obvious.
But I can also get a haircut, but I can't enter a library. So I'm just curious, like, why museums and libraries?
The libraries you can still use, but at curbside. Yes.
For the Department of Health. One, you mentioned only 4,500 doses have been administered, and I'm just wondering why. I mean, if you're holding some back, or if it's just slower to get them out. If you can just explain.
Yeah.
That.
It's actually incredible that we were able to vaccinate 4,500 individuals when we were receiving vaccine as late as Wednesday, which then requires the providers to understand how to use a vaccine, get appropriately trained, and then actually vaccinate as well. So the delta of time is actually pretty small for the number of vaccines we're able to administer in a handful of sites as well. It is likely that most of these vaccines will be administered by December 25th as well. So we have an incredibly high use rate of the vaccines that we've received. Additionally, with the future vaccines we are receiving, as we've noted, we are extending our access points and other areas in which there are vaccinators, which will help us utilize the vaccine as much as possible. These are all first dose vaccines. We are under the impression from Operation Warp Speed that there will be a second dose shipment as well.
On hospital data, and the mayor mentioned before, I believe we have seen an increase in the percentage of COVID patients in hospitals go up every day for a month now, and it's doubled over the past month. What can you tell us about your concerns for hospital capacities? And I know we see the aggregate data, but have any individual hospitals neared or reached 100% capacity? How close have any individual hospitals gotten so far?
So what we've been able to do throughout this pandemic is work with our healthcare system and our hospital system to load balance patient and bed usage across the district. So that overall number is an accurate understanding of the total bed capacity within the district. And as that number increases, the district hospitals are working together to ensure there's appropriate capacity at each hospital by really load managing. And then also, this is outside of a bed surge. So I do want to make sure we all know that there is extra capacity within our hospital system that is outside of this number. This is with regular operations. We're currently at 82.4%.
Individual hospitals hit 100% or close?
We have not seen that at this time.
And one last question for you, so I appreciate your patience. Have you seen anything, should we be concerned about this new variant strain that we're seeing in Europe, and have you seen any indication of that here in Washington, D.C.? What briefings are you getting on that?
Yeah. Our DC Health team is closely monitoring what's going on in England, as well as the CDC, the Centers for Disease Control and Prevention. At this point, it is too early to say confidently or thoughtfully anything about this virus. What we do know is that we currently have our COVID-19 pandemic right now is we are seeing increase in cases, and that's why I do want to reiterate one of the big ethos of this of today's discussion is ensuring that we mind our decisions and our activities wisely, not travel for this holiday period, and really be thoughtful about the individuals you interact with as well, wear a mask and socially distance. So we're still monitoring what's going on in Europe, but I think there's plenty of things we could do right now with our current pandemic.
Yes, ma'am.
Thank you. I have one question for Dr. Shaw and one for the mayor. Dr. Shaw, can you tell us why it seems like DC is getting fewer doses of the Pfizer vaccine from Operation Warp Speed in the next shipment than the first one?
Yes, so this is purely dependent on what our federal government allots to the district. I think, as well known now, the district is receiving allocations based on population, not on workforce. However, Phase 1A and Phase 1B are based on workforce, our healthcare workforce, as well as our essential workforce, essential services workforce. So we are getting less than what we deserve, and that is a simple fact. The doses from that we're receiving less is really based on what the federal government has been able to procure from Pfizer. As you've probably noticed across the nation, other states have reported decrease in Pfizer allocations as well. For the District of Columbia, we have been thoughtful in ensuring we know exactly how many doses we're receiving before connecting and creating a plan with our provider. So luckily for the district, we have not had to tell our healthcare workers or our hospitals that they are receiving less. What we have told them, they actually are receiving.
Thank you, that's very helpful. And Mayor Bowser, some of the CARES classrooms have closed because of positive coronavirus tests. Does this change your confidence in any way going into the winter when schools?
No, I think it gives me confidence that the system is working as it should.
Know of any cases of the virus actually spreading within schools?
I do not.
Thank you.
Okay. Thank you, everybody. I want to wish you a very happy holiday season.